Hi everyone, I am Dr. Soumya, consultant neurologist and epileptologist at Lisi Hospital, Kochi, Kerala. Is epilepsy curable? So, when we speak about curability in epilepsy, we refer to the control of seizures. So, if a person with epilepsy is, is free of seizures for a period of minimum 10 years and is off medications for a period of 5 years, he is said to have a remediable form of epilepsy. So, how do doctors try to achieve this remedy? So, the first and foremost thing is medications. We have umpteen number of medications available to control seizures. So, it has been found that in around 70% of persons with epilepsy, seizures can be controlled with one or maybe two medications. So, what happens to rest 30% of persons with epilepsy? So these are the candidates where we should do a pre-surgical evaluation and try if epilepsy can be controlled with the help of surgery. So we consider surgery in patients who have seizures which are not controlled with two medications for sufficient period of time and who has disability and poor quality of life with respect to the seizure burden, and those who have a focus which has been identified through imaging, any modality of imaging, which can be removed with the help of surgery. So we see that among these 30% who are medically refractory, around 10 to 15% of the individuals respond well to surgery. So among the whole population with epilepsy, it has been found that around 80 to 85% of individuals can be cured with one or two medications or sometimes with surgery. So, what happens to the rest 10 to 15% of the individuals? So, in those, we have to try additional modalities of treatment like deep brain stimulation, vagal nerve stimulation, or sometimes special forms of diet like ketogenic diet. Another question which we deal with is whether patients with epilepsy can lead a normal life. A normal life can be led by majority of the persons with epilepsy, but they can just like how others do, they can lead a normal life working, socializing, and doing all their hobbies what they want. But we have to make sure that the safety is not compromised and still their lifestyle should be modified based on their conditions. So thank you for a patient listening.